Calcium is an important extracellular cation in the body. The vast majority, around 99%, is stored within the bone as hydroxyapatite. Only a small percentage circulates in the plasma, but it is this amount which has the many important physiological effects. And just 0.01% exists inside the body's cells, with low levels maintained by different membrane calcium pumps. This interchange between the bone stores and plasma is controlled by the actions of osteoblasts and osteoclasts of the bones, with close hormonal regulation. Calcium in the plasma exists in three main forms. About 45% exists as a free and physiologically active ionised form. About another 40% circulates bound to albumin. This calcium is termed non-diffusible because of its bound status. The final 15% is complex with molecules such as citrate, phosphate, oxalate or sulfate, which although diffusible are not physiologically active. The total calcium that is measured on blood testing includes all of these forms and may be subject to error in cases where there is low albumin. These forms are clearly in relationship to each other. The calcium levels can be changed depending on the albumin levels and also the ability of the albumin to bind calcium. For instance, with a rise in pH, the albumin is more able to bind calcium and thus lowering the levels of the ionised calcium in the blood. This is the mechanism for the hypocalcemia symptoms we see in hyperventilation. The normal range for total plasma calcium is 2.25 to 2.65 millimoles per litre. It has a number of essential physiological functions, including acting as a secondary messenger, muscle contraction, hemostasis, membrane excitation, hormonal secretion, and structural support, including intracellularly as well as in the bone.